I'm Dr. Scott McFarland. We've all experienced it at some point in our lives. Pain in the lower back. The back is a complex system of bones, cartilage, muscles, and nerves that all work together to support the whole body.
The bones make up the spinal column and provide the structure that allows us to walk upright. It's rigid enough to provide support, and yet it's flexible enough to provide a lot of movement. The spinal cord and brainstem, and the nerves run throughout the middle of the spinal column. And between each pair of vertebrae, there's a side opening on each side through which a branch comes out and goes to different structures in the arms, body, and legs. And this structure controls movement and sensation throughout that region.
The low back is the lumbar spine, of which there are 5 lumbar vertebrae. And between each of those vertebrae are discs, and adjacent to those vertebrae, but part of them are facet joints. And this combination of bone and disc and facet joints in the nerves and other soft tissues that are associated with that structure oftentimes can be the source of significant pain.
Low back pain is generally categorized by how long the pain has existed. Acute low back pain refers to pain lasting less than 1 month, and chronic low back pain is pain lasting for more than 3 months.
The most common problem we tend to see is arthritic changes in the lower spine, and that's basically wearing out of the joints. And that happens in virtually everybody over time. Sad to say, but the changes start probably pretty early in life, maybe in the 20s and 30s.
The majority of people who experience low back pain do not require medical care. However, those suffering for a prolonged period of time may seek medical attention in an attempt to relieve some of their discomfort. But due to the complexity of the spine, diagnosing the cause of low back pain isn't necessarily easy. And the sad truth is, some patients may receive treatments that won't help with their pain.
The mystifying thing about low back pain and what makes low back pain especially difficult to treat is the fact that 85% of the time we really can never identify a cause for low back pain.
You to bend straight forward now and just touch your toes.
20 years ago, when somebody hurt their back, we would tell them that they should go to bed for a week and hopefully they would get better. We now know that this hurts patients and doesn't help them. They will recover much more quickly if they remain active.
Age is an important factor in low back pain. We do know that people, as they get older, they experience changes in their back. Overweight is a risk factor for low back pain. Smoking has actually also pretty consistently been shown to be a risk factor for low back pain. There's certainly risk factors related to lifestyle, so people who have a job with a lot of physical demands tend to have more low back pain. Stressful jobs are associated with more low back pain. People who have depression actually have a higher incidence of low back pain as well.
Individual differences also are a factor in determining who experiences low back pain.
What we're finding is that patients who have chronic pain have different neurological activity in their brain when they feel pain. So if you have a patient who's never had chronic pain, chronic back pain, and you put a fixed weight on their thumb, enough to kind of make it uncomfortable, they'll have a small area of their brain that represents the sensation for the thumb light up. If you have a patient with chronic back pain, undergo the same procedure where a small weight is put on their thumb, large areas of the brain light up. So these patients may be hypersensitized to feeling pain.
So everything looks in place.
While identifying a cause of the pain may be a mystery, determining how to treat it can be very straightforward.
There's a lot of treatments for low back pain. You can kind of group them into categories, and so there's medications are one group. Once you get away from the medications, there's actually a variety of therapies that we think can be helpful in people with low back pain. These include more traditional things like exercise therapy.
Exercise therapy or physical therapy is really aimed at helping patients move correctly. Our bodies are built to be active. Using those muscles and joints helps the body stay strong and prevent injury. The goal for physical therapy is to correct poor posture. and muscle imbalances by applying strengthening and flexibility techniques.
Most people who have low back pain are not fit. Sometimes they are fit, but most of the time they're not fit, and they can be somewhat inflexible, and they can have poor tolerance for doing exercises, and they might not be very strong. And so we would send them to a physical therapist to learn how to increase their flexibility and their endurance and their strength, and that often alone will cure low back pain.
Other non-pharmaceutical options available for patients are things like spinal manipulation, massage, and acupuncture. Doctors say it is important to consider all non-invasive methods of treating low back pain first, before a patient considers surgery or any other invasive procedure.
When people are being recommended for very invasive therapies like surgery and things like that, I think it's important for patients to get accurate information about the options and alternatives because there are a lot of people who would really love to avoid surgery.
There's so many patients who have undergone surgery to fix some anatomic problem in their back, and yet they did not get relief. And sometimes they get multiple surgeries, just seeking relief again and again, maybe the second time or the third time they'll get it right. But they end up with chronic pain and more scarring. And if you damage something that was not causing pain, if you break something that wasn't broken, then it can cause its own cascade of problems. When things are not crystal clear or not precise, which is often the case, try to exhaust all alternatives before jumping to invasive procedures.
It bears repeating. In most cases, low back pain will heal itself. The important thing to remember is to try to stay active. Keeping the bones, muscles, and nerves flexible can help speed up the healing process. But if the pain does not go away after several days and begins to interfere with your quality of life, it might be time to see a health professional. There are treatments that can help. To answer any specific questions you may have, be sure to contact your healthcare provider.